Let me repeat again so you folks can hear. So there is no in-person class next week, next Friday for the final. You folks will have to take care of the on Canvas under Portfolio. Exam will start at 9 o'clock, turn off at 3 p.m. No extension. No extension for the final exam. If you have any internet problem, please take care of before the final. Don't email me for the extension because that is the final exam. And as far as the extra credit concerned, for IPE, Dr. Torres already added those 5 points under exam 3. Was already taken care. 5 points for IPE for the student who attended that class or Zoom. And pardon?
How many points?
5 points. 5 points for IPE, and he already added in under exam 3. That's what he emailed me.
Not one.
Okay. So now for today's chapter, we have chapter 9, chapter 10, and chapter 11. I will discuss as needed because most of over here, the definitions we need to know. And also time to time, I will give hint. Please, I will give hint for the final also. So please pay attention in my discussion. I cannot say this is for the final, this is not for the final. So pay attention to the discussion. Let me take care of the attendance. I need to know the student's name. Marianne Aduguba, is she here?
Here.
Thank you. Victoria Aduguba? Not yet.
Here.
Okay, thank you. Libertson, Katamichan, Libertson. Andrea Lopez.
Here.
Oh, in the person right now? Okay. Thank you. Oh, you changed with the Julia, right?
Yeah.
Thank you. And I do have in Zoom, Andrea Levadia.
Yes, I'm here.
Yeah. And Julia Mendoza. Yes?
Here. Here.
Okay. And Marian Garcia in Zoom.
Good morning, I'm here.
Yes. I have Ray Penida.
Yes, Professor, here.
Thank you. Tanya Collins
I'm here, Professor. Good morning.
and Jocelyn Tafal. You emailed me this morning.
Yeah, Professor.
And in-person class, Mecca King, not here. Trinity Fiona, thank you. Angie Iris, you on Zoom, right? Angie Iris,
I'm here.
okay. Sandra Fong is also on Zoom. Is that correct?
Yeah, Professor, I'm here.
First one in my class. Okay. Monique Margaret.
Here.
Thank you. So Libertson is here. Karen.
Here.
Thank you. Matthew Q. Thank you. Melissa Mina. Thank you. Mia Montigny. Thank you. Maura Keith. Thank you. Andrea Gerard. Here. Oh, thank you. Alexa Piscina. Ray Beats. Ray Bear. Stephanie Ruiz. Stephanie Ruiz. Not yet.
Car issue. She's on her way right now, though.
She's
She had car issues, but it's settled. She's getting through it now.
okay. Roger Salvador. Thank you. Anthony Sanchez, I think you joined in Zoom. Anthony Sanchez.
Yes, Professor, I'm here. Can you hear me?
Ulysses. Kathleen Cho. Thank you. Mesha Smith. Thank you. Kathleen Ashley. Thank you. Marvin Soto. Thank you. Janelle, are you in Zoom?
No, I'm here.
Oh. Jonathan Tapawan. Jonathan. Yeah. Thank you. Marcis Tolentino. Thank you. And Evelyn Vieira. Evelyn Vieira. Stephanie Ruiz is not here, and Evelyn Vieira is not here yet.
Yes, I'm on Zoom.
She's on Zoom.
So everything is clear with everybody. So next week, no in person, everything on Canvas under Proctorio, and final start at 9 a.m. And folks, I also forgot, make sure on Zoom also, you folks will join me in Zoom at 9 o'clock for attendance. After attendance, I will disperse you guys for the final. Is it clear? So meet me in Zoom for attendance, and after attendance, I will guys disperse you for the final. Okay. Chapter 9. So let's discuss. Is about the inflammation. First of all, what is inflammation? In the textbook, look at the definition of inflammation. It is on page 224, page 224, the definition of inflammation. And then these are the 4 cardinal signs of inflammation. You cannot miss these 4 cardinal signs. Number 1, rubor, the area becomes red. Tumor, the area becomes swollen because of edema. Then the area where, when we compare with the surrounding area, the area is hot, we call calor or heat. And then the patient complains of pain, we call dolor. And then the last one, they said functionalisa, loss of function of that part. So please remember, these are the 5 cardinal signs of any inflammation in the human body. Make sure know the definition of inflammation. It is the body response to any sort of insult to the body. When the body is insulted, body reacts in the form of inflammation. Is it clear? So that is inflammation. And during inflammation, our body tries to get rid of the a harmful agent, contain the harmful agent, remove the damaged tissue, and then help the process of healing. Now, the factors involved in protective responses and bodily repair. Number one, inflammatory response. Then we do have immune response because of our immunity. And later on, the tissue need to be repaired and wound healing will take place. Tissue repair may be the same type of tissue. If not, the tissue we use, other than the same type of tissue, we use the fibrous tissue. Fibrous tissue. Fibrous tissue, when they help in the process of healing, they leave some mark at the site of healing. We call it scar tissue or scar mark. Causes of inflammations. Number one, immune response to any infectious microorganisms. Immune response to any infectious microorganism. Microorganism enters, our immune response will take care. Immune response, we have cells and mediators. Number two, and among the most important immune response cells is the lymphocytes. Lymphocytes. We have different forms of lymphocyte. We call T lymphocyte, B lymphocyte, and so forth. And also the macrophage, the big eater, which is coming from my monocytes. Now the trauma, number two. Number three, surgery, any surgery. Chemicals when enters, we call caustic chemicals. When enter, they produce inflammation. Extremes of heat and cold, sunburn, frostbite. Ischemic damage to the body tissues. Now, this is the type of inflammation we call granulomatous inflammation. Granulomatous inflammation. Most common cause of is a long-standing inflammation. We call granulomatous inflammation, and it is associated with the foreign bodies when enter the body. Any foreign bodies when enter, like what? Like any splinters, like suture materials. Suture we use for surgery. Some sutures materials, some patients are not comfortable with those suture material and they lead inflammation. Then we do have silica, industrial, and asbestos. Asbestos is now banned. So all these, look at this, all start with S. Splinter, suture, silica, and on the top is asbestos. Now associated with microorganism that causes, these are also causes granulomatous inflammation like tuberculosis, syphilis, sarcoidosis, fungal infections, not superficial, deep fungal infections, and brucellosis. Now, vascular changes that may occur with inflammation. Folks at the back, please. Vascular changes that may occur with inflammations, we divide into three broad groups. Number one, immediate transient response, which occurs within minutes. Then immediate sustained response, then followed by delayed hemodynamic responses. Immediate transient response occurs with any minor injury to the body. Immediate transient response, which occurs with any minor injury to the body. Then we do have as we said, immediate sustained response occurs with more injuries, more severe, more grievous type, and continues for several days or weeks and damage the vessels in the area. Now, followed by the third one is delayed hemodynamic responses, changes in the blood vessels, involve an increase in capillary permeability. The blood capillaries become more permeable because of histamine and others. That occurs 4 to 24 hours after injury. Okay. Now this cellular stages of acute inflammation. In acute inflammation, there may be changes in the vessel, blood vessel, or changes in the cellular mechanism. The cellular stage of acute inflammation, number one, marked by movement of phagocytic white blood cell. Highlight and remember, it is the body protective cell. We know it's leukocyte or WBC. Leukocytes or WBC, they are the first to reach the site of injury or site of inflammation. Now, the two types of leukocytes participate in acute inflammation, acute inflammatory response. Please remember these two. First group is under my granulocytes, like neutrophil, eosinophil, basophil, all Phil except Dr. Phil. Yes, I don't know you folks remember or not, Dr. Phil. So all the granulocytes, all Phil. Then the second group is the monocytes. Monocytes is the largest, please highlight them, these are the largest of the WBC series. Largest of the WBC series is the monocyte. And these monocytes differentiate into macrophage also. Neutrophil, monocytes, macrophage, these are all phagocytic cells of the human body. Now, the cell move in response, and that's the direction of cellular response we call margination, followed by adhesion, and followed by transmigration. They come out from the blood capillaries. And these are in the form of cytokines, adhesion molecules. All these substances, cytokines, participate in inflammation. They invite the inflammatory cells at the site of injury. Now, inflammatory mediators, please highlight, is called histamine. Histamine is the important. And then we do have cytokines. Cytokines we do see in two different forms, arachidonic acid metabolites. Please highlight prostaglandin, leukotriene, and omega-3. Prostaglandin, leukotriene, and omega-3 polyunsaturated fatty acid. Omega-3. So common right now over the counter. Now, we do have platelet activating factors and we do have plasma protein. Okay, now the classification of inflammatory mediators by function. We do have various types of inflammatory mediators and they do also have their own functions. Number one, those with vasoactive and smooth muscle contraction. That means they are causing vasoconstriction. That means they call constricting properties. Number two, chemotactic factors such as complement fragments and cytokine. Complement, we do have complement protein in the blood. Normally, these complement proteins, they are in the blood in inactive form. So in order to make them functional, they need to be activated. So chemoactive, and these complement protein, they help in chemotaxis, or they act as a chemotactic factor. That means the chemical which invites the cell, come on, eat, come on, eat. So complement is a protein which invites those protective cells. I am the foreigner over here, and my complement protein attached to me, that gives a signal to macrophage, to monocyte, to neutrophil. They come and eat phagocytosis. That's how it happens. Now the plasma proteases, number 3, that can activate complement proteins and components of the clotting system. Clotting protein, clotting factors, they're also in the blood in inactive form. They need to be activated. And these plasma proteases, the enzyme which activate not only my complement, they also activate my clotting factors. Okay, the last one over here is the reactive molecule and cytokines liberated from the leukocyte, WBCs, which when released into the extracellular environment can damage the surrounding tissue. So that is because of the inflammation. Inflammation is like what the firemen are doing. Whenever they go to control the fire, they put a fire around the fire so that the fire doesn't spread. Inflammation is also a type of firework. They destroy the surrounding tissue already, and there's already destruction going on in the center of the tissue. So whatever tissue is damaged is not going to spread. So they contain inflammation. The inflammation is to contain the spread of infection or injury. And later on, they remove those dead tissues and replace with the normal parenchymal tissue or scar tissue. Okay. Question is, which of the following molecules induce endothelial cell retraction? Endothelial cell, lining of the blood vessels or blood capillaries. When they become retracted, that means they shrink and they create a gap between the endothelial cells of the blood capillaries. What will happen? When the endothelial cells, they retract each other, there's a gap in between so that the plasma can come exudate out. So it is done with the help of histamine. Histamine is a primary activator of endothelial cell retraction. Look at that one. Endothelial cells shrink, and in between the endothelial cell, the space is created, and the capillaries already leak. They become more leaky. And as a result, increased permeability of the vessel causes exudation of fluid, causes edema, and that edema, that is swelling, and then lead to pain. So histamine did its job. Now we are talking about different types of fluid, formation with different types of fluid during inflammation. There are 5 different types. Remember, there are 5 different types. Number 1, serous. Number 2, hemorrhagic. Number 3, membranous or pseudomembranous. Number 4, purulent, pus-like, and the 5th one is called fibrinous, of the forms of fibrin meshwork. Let me go back. The serous, which is watery. Serous exudate watery fluid, low in protein content. They are coming out, they are present in the protein, those are present in the plasma. Endothelial cells shrink, retract, they make the capillary permeable and the fluid is coming, that fluid is called serous exudate. A result from plasma entering the inflammatory site. Number two, hemorrhagic blood occurs when there is a severe tissue injury that causes damage to the blood vessel or when there is a significant leakage of red blood cells from the capillary. So RBC is also leaking out. They're making a fluid exudate which is red stain or red color, and that's what we call hemorrhagic. Because we do see in the hemorrhagic exudate, we take the tissue, we see those RBCs are there. That's what they call hemorrhagic. Now, membranous, also called pseudomembranous, develop on the mucous membrane surface, especially patient with diphtheria. When the kids suffer from diphtheria, the membrane or membranous or pseudomembranous exudate form on the surface of my tonsils, and that is membranous exudate developed on mucous membrane's surface, are composed of necrotic cells and mesh in a fibropurulent exudate. It has the fibrous tissue, fibrin, and the pus cell. Now, the purulent form we also call suppurative, contains pus. It's composed, pus which is composed of degraded white blood cell, proteins, and tissue debris. Pus is whenever there's a fight at the site of injury between the foreign microorganism and the WBC. During the fight, some of the neutrophils are destroyed. During that fight, they destroy the local tissue also. As a result of that fight at that site, they form a pus. So pus is a collection of dead tissue. Pus is a collection of dead and alive WBCs, and also the foreign agent or foreign microorganisms or chemical. That's why the pus is sometimes different color. Sometimes, most commonly, these are yellowish color. Some pus, they have different smell, depending on the microorganism also. Okay, so the fibrinous exudate contains large amount of fibrinogen, one of the blood clotting factors, and forms a thick and sticky meshwork at the site of injury. That's what called fibrinous. Now, please, folks, remember, we divide the inflammation into two broad groups, which is acute and the chronic. Acute inflammation and chronic inflammation. Now, if they talk about acute inflammation, it is of short duration, non-specific, early response to injury. Non-specific, early response to injury, duration is short. That's my acute inflammation. This acute inflammation is aimed primarily at removing the injurious harming agent and limiting the tissue damage and helping the tissue repair. That is acute inflammation, short duration. All of a sudden, severe pain, the area becomes swollen. That is acute inflammation. And then sometimes, if the healing process is not complete, they go into chronic inflammation. Chronic process of chronic inflammation. Longer duration, lasting for days, weeks, or years. That's chronic, like my tuberculosis, like my AIDS. Tuberculosis, AIDS, all these are a different skin condition, skin lesions. They are all chronic type. chronic inflammation. Okay, so we mentioned about, if you folks remember, we mentioned about the tuberculosis. Please remember, mycobacterium tuberculosis, which causes tuberculosis, which we discussed, and also we mentioned about the person who is already vaccinated against the tuberculosis back home with BCG, he or she is going to have positive tuberculin test. That doesn't mean he or she has tuberculosis. In order to confirm, he or she need to undergo chest X-ray to confirm tuberculosis, because he or she already had BCG vaccination back home. Now, the other lung conditions, please remember, especially with over here, I mentioned about tuberculosis. Also remember asthmatic attack, which we discussed, asthmatic attack, acute asthma. And then in order to confirm the asthma, we do perform forced expiratory volume. We check the patient forced expiratory volume to confirm he or she is suffering from asthma or not, which we discussed. And please remember pneumothorax, tension pneumothorax, spontaneous pneumothorax, which we discussed also. Okay. Now, if you look at the chronic inflammation, I will go back again. If something pops up over here, I will definitely speak out. Number 2, chronic inflammation is a longer duration lasting for days or years. A recurrent or progressive acute inflammatory process usually is a low-grade smoldering response that fails to evoke acute response. Especially tuberculosis, they do have low-grade temperature. Complain that in the evening, doctor, in the evening, I have my temperature rise. Tuberculosis. Chronic versus acute inflammation. There's a distinction over here. Now, acute inflammation is self-limited and of short duration. That is the characteristic of any acute inflammation. We do have protective cells in the body. Neutrophil is this cell, the key player over there to contain the infection. For acute inflammation, during that fight, they do produce exudate. Now, the chronic inflammation, and that, if you look at that, whenever there is any bacterial infection, whenever bacteria invade the body or enter the body, my neutrophil count goes high. If, this is number 1, if any allergic response or parasitic infection take place, we do have increase in eosinophil. Eosinophil count goes higher. If the person got attacked by the virus, normally neutrophil count goes down and lymphocyte count goes high. During any viral infection, neutrophil counts go down and the lymphocyte goes high. This is, with looking at those blood pictures, differential count, that can give me some idea. I suspected the viral infection. This is my result. Bacterial infection, normally all bacterial infection lead to increase in neutrophil count, neutrophilia. These are all in the textbook. So please remember. Now, for the chronic inflammation over here, if you look at that one, these are self-perpetuating and may last for weeks, months, or even years. That's the chronic inflammation. Over here, infiltration by mononuclear cells, which is my D macrophage, and the lymphocyte. Now, during chronic inflammation, the healing process is taking place mostly by the fibroblast cell. And when the fibroblasts are participating, they help in the formation of healing of this tissue with scar formation. Please remember, there are 4 phases, 4 prominent systemic manifestations of inflammation. Acute phase response. Number 2, alteration in the white blood cell count. I mentioned already what happened when bacteria enters, what happened when allergic reaction take place due to any food or any chemicals, or when the viral disease or viral condition or virus enters, we do see decrease in neutrophil and increase in lymphocyte. Then also, they release chemicals during inflammation that cause an increase in temperature, fever, and in severe cases, we do suffer from sepsis. And more severe cases, that sepsis lead to septic shock and then death. Okay. Question is the following statement true or false? Okay, this is about the cells. We have different types of cells. We have labile cells, stable cells, and the permanent cell. The permanent cell never, after their formation, never undergo regeneration. Labile cells normally stop after their growth, after their formation, and labile cells keep moving all throughout the life. The question was, is the following statement true or false? Permanent cells, once damaged, can easily be regenerated and their functions recovered. False. Permanent cell is permanent. Like permanent cells in the human body, we have a cardiac muscle cell, skeletal muscle cell, and my nerve cell, cardiac muscle strand, and skeletal muscle cell. These are all permanent cells. Once they are formed, destroyed forever, replaced by the other types of tissue or scar tissue or fibrous tissue. Okay. Now, types of structures of body, organs, and tissue. Normally, any organ, we do have their cells, and around those cells, we do have tissues we call stromal tissues. Now, the main cell of any organ we call parenchymal. Parenchymal tissue contains the functioning cells of an organ or body part. Highlight and remember. Parenchymal cells. What is parenchymal cells? These are the functioning cells of an organ or any body part. Liver cell cannot function without hepatocyte. Liver cannot function without hepatocyte. Liver cells also we call hepatocyte. What it does, liver cell produce bile. Liver cell perform all different types of metabolic function. Then we do have in the kidney, we do have renal tubular cells. Those renal tubular cells of the kidney tubule perform their function in various types of transportation. Now, the second group of tissue within an organ or body structure we call stromal tissue. consisting of supporting connective tissue around the parenchymal tissue. We do have supporting connective tissue. Those tissues are called stromal tissue. Within that connective tissue, we have the blood vessel, the nerve fiber, the lymphatics, and all other structures. Connective, and also we do have in some places like fat cell. Fat cell also act as a stromal tissue. Extracellular matrix and the nerve fiber. All these are the content of the stromal tissue. So within the connective tissue of this stroma, we have the blood vessel, we have nerve fiber, we have lymphatics, and also other proteoglycans. Okay. We already mentioned about the Leval cells, that 3 different types mostly. Leval cells continue to divide and replicate throughout the life. My RBC, my stratum cornea, keratinocyte, all those form elements in the blood, all those lining cells of the mucous membrane, always 24/7, they are replacing. Stable cells normally stop dividing when the growth ceases, especially the kidney, the liver. Those cells are stable cells. When the part of the liver is damaged, the important characteristic is they are stable. They can multiply. They can regenerate and perform the same type of, produce the same type of cell with the same function. That's the plus point for the liver, also for the kidney also. But permanent cells, they cannot. I mentioned examples of permanent cells. Nerve cells, cardiac muscle cells, and the skeletal muscle cells, these are all permanent cells. Okay. Also, if you folks remember, we discussed discussion from weeks ago. We mentioned about the atrophy, the tissue, the organ is innervated, but I'm not using it. That goes under atrophic change, atrophy, hypertrophy, hyperplasia, dysplasia. These are all we discussed earlier. Now, what is apoptosis? What is apoptosis? Anybody know what is apoptosis? Cell death. It's a programmed cell death. They have this, they life span for particular duration, and then after that, gone. Apoptosis, which we already discussed. So what is liver, for which we discussed hepatocytes? Because of the chronic inflammation within the liver, they are replaced by the fibrous tissue. Sometimes they produce nodules, sometimes no nodules, and they form scar tissue. And I have the habit of drinking alcohol, and my liver is now producing an inflammation that's called what? Cirrhosis. Cirrhosis. The liver tissue is replaced by, liver cells are replaced by the fibrous tissue, cirrhosis of the liver. Now, they also, during my condition of the liver, they said you have some tumor in the liver, we need to do biopsy. And after biopsy, they put me in the post-operative, and they're looking for the nurse. They have to be very vigilant for what?
Bleeding? Bleeding? Bleeding?
Bleeding. Bleeding, that's what you said? Yes. Bleeding, because liver, they took the tissue from a liver, and the wound, they repair it, the chances of bleeding might occur from my tissue which they took for biopsy. The nurse has to be very vigilant for bleeding. Okay. Okay, let's get back to the slide. Healing, there are two different types of healing. One is by primary intention. Number two is by secondary intention. Primary intention, when the wound is clean cut, complete healing will take place within short duration, and that's called primary healing. Primary healing. So the objective of healing process is to fill the gap created by tissue destruction. The objective of healing process is to fill the gap created by tissue destruction and to restore the structural continuity and function. Primary healing, when the wound is small, clean wound, not infected, not contaminated with soils and others, and the healing will take place, complete healing will take place without any scar tissue formation. That is called primary healing. Now the secondary healing, there's a great loss of tissue or tissue damage, and the dead tissue are contaminated with the soils and other contaminated objects. Healing will take place, but it takes place in a long duration. We need to clean the wound with all those contaminated objects or material, and then sometimes we have to leave it open to see how it's responding. Then sometimes we have to put patch, skin patch or other patch to help in the healing process. So that is not taking place by primary, they will heal by secondary. And for secondary healing, we have to be patient. Patient has to be patient because it takes time for healing. Now, basic components of please remember, the basic components of the extracellular matrix, whatever we have outside the cell, outside the cell of any organ or structure. That's what we call extracellular matrix. Now, they are in the form of fibrous structure proteins. Those are my collagen protein and elastin protein. These are protein fibers, collagen and elastin. Now, number two, within that extracellular matrix, we do also have water hydrated gel, which attracts water, and that permits resilience and lubrication. and that we call proteoglycan and hyaluronic acid. This is also part of my extracellular matrix, not only protein and collagen fiber, we have proteoglycan, hyaluronic acid, and also within that extracellular matrix, we do have adhesive glycoprotein. What it does, it connects the matrix elements to each other and to the cell to hold the organ in place. Fibronectin and laminin. So please remember, most we discuss collagen, elastin, collagen, elastin. Collagen is stronger, elastin is elastic. Basic forms of extracellular matrix. They have the basement membrane, the outer limit, outer boundary, we call the basement membrane. That means it surrounds epithelial cells or endothelial cells or smooth muscle cells. All those, if you look at those all epithelial cells, in order to keep the epithelial cells in place, they need a basement membrane. This is my epithelial cell. This is my endothelium. This is my smooth muscle cell. These cells is going to be in place if we have basement membrane. It's like a basement membrane is like a concrete. If you want to put your block, cement block in place, we need a concrete at the bottom so the cell can stay in place. Those cells are my epithelial cells, endothelial cells, and smooth muscle cells. So they need a basement membrane. Now, interstitial matrix, they're present in the spaces between the cells, the connective tissue, and between the epithelium and the surrounding cell, which we already discussed. Stages of wound healing, these are, we call inflammatory phase, proliferative phase, maturational, or remodeling phase. Steps in development of the new. Now, whenever there is a chronic inflammation, will take place, these things has to happen. Formation of new capillary blood vessel, and the tissue looks red during healing process. And why it looks like? Because there are new capillary buds are formed. They are coming like sprouts. So, proteolytic degradation of the parent vessel basement membrane. Basement membrane is gone, allowing the formation of capillary sprouts. And through that damaged basement membrane, endothelial cells will protrude. That's why it says capillary sprouts will come out. Migration of the endothelial cells from the original capillary towards an angiogenic stimuli. That's how the tissue healing is taking place right now, because we need to create a blood vessel, the capillaries, which then after their formation, they will bring the blood, nutrient-rich blood, oxygen-rich blood, so that the damaged tissue can start the healing process. Okay, so number 3, proliferation of the endothelial cells behind the leading edge of the migrating cell. Migrating cells, they are helping the healing process. Maturation of the endothelial cells and the proliferation of the pericyte is the cells around the blood capillaries and smooth muscle cells, which help in the formation of blood vessels. Okay, please remember, question is, which of the following will promote wound healing? Wound healing, if I'm malnutrited, suffering from lack of vitamins, lack of protein, lack of muscle protein, fat, and others, malnutrition, or I'm having a trouble in absorbing nutrients because I have some chronic disease in my GI tract. Malnutrition, or suffering from infection and presence of foreign bodies. All malnutrition, infection, foreign bodies, these are the cause for impaired wound healing. But what promotes the wound healing is increased blood flow and oxygen delivery, because the blood vessels are there. The capillaries are formed. I'm putting this slide, which is already discussed. If you look at that one, please remember the causes of impaired wound healing. Causes of doctor, he gave me everything, all those antibiotics and others. But I do have some underlying condition in my body which is hampering the healing process. Maybe I'm suffering from cancer, or maybe I have some malnutrition going on. He gave me all good antibiotics, but still my wound is not healed. So please remember, or maybe when they clean the wounds, because I will end up in road traffic accident, my wound was contaminated with the soil, they didn't clean it thoroughly, still some remnants are there in the tissue, and they give me antibiotic and they did everything, but those foreign agents from the soil still present that delays the wound healing. Okay, so, and also my age. Age is also factor. So malnutrition, impaired blood flow and oxygen delivery, impaired inflammatory and immune responses, maybe infections, maybe wound separation, foreign bodies, and age effect. These are all the factors which might cause impaired wound healing. So this is the answer. Increasing blood flow and oxygen delivery is one of the main objectives of inflammatory response. Remember, the blood vessels are formed. In order to heal that tissue, they need to form first, the groundwork is they need to form the capillary network. Those capillary network, when they form, so those capillary can bring the blood, which is rich in oxygen, which is rich in nutrients. So this will allow for greater energy production and the faster removal of dead tissues or dead material. Okay. Factors regulating the healing process. Number one, action of chemical mediators and growth factors that mediate the healing process. Number two, interaction between the extracellular matrix and the cellular matrix itself. Phases of scar formation, two phases of scar formation, immigration and proliferation. Normally, tissue try to replace by the same type of cell. And when they replace by the same type of cell, doesn't leave any scar at the site of healing. But when the fibroblasts are involved, then formation of scar tissue will take place. So immigration and proliferation of fibroblasts into the site of injury. And then deposition of extracellular matrix by these cells, which is already mentioned, impaired wound healing. Okay, that's the end of the slide. So let's take a break. So, returning time 10:30. 10:30 is the returning time. Right now, 10:10 almost. So 10:30 is the returning time. We will discuss chapter 10, and time to time also I will release some information. So have a break Returning time is 10:10.